Welcome to the Digital.Health Studio Series. I'm your host, Risa Vatanka, co-founder and CEO of Digital.Health. And at Digital.Health, we are a platform and global community on a mission to accelerate adoption of digital health and AI-enabled solutions to usher in a new era of health. Our Digital.Health Studio Series is where we create space for innovators their uh, to share the advanced technologies that they're building, and for clinicians and people with lived experience to share how they are effectively integrating these technologies to address gaps in care and improve the quality and access of care we deliver. And as we know, it's not just the technologies, but it's the people and processes that are key to broad adoption and scaling. So we're really excited to bring this episode of the Digital.Health Studio Series to you. This month, we're talking about Hospital of the Future, advancing smart, connected care through AI and data-driven innovation. Here's the format. We will begin with our What's New and What's Next in Health and Tech episode, and then we will move on to our guest presenter talking about a landscape overview and what's happening at the intersection of health and tech. And then we'll have our deep dive into our panel discussion. So at this time, I'd like to invite my co-host to join me. Welcome, Daniel, the one and only Dr. Daniel Kraft, brilliant scientist, futurist, physician, innovator. Daniel, you are excited about this episode?
Yeah, I think the theme of shifting where care happens, hospital to home, hospital to hospital, whatever you want to call it, is really reaching a new inflection point. And I'm excited to have our amazing panelists and the discussion to explore what's now, near, and next, and how digital health and AI are all converging to change how we do care.
Beautiful. All right. Well, all right, you are always jet setting around the globe. And those who know you well know you don't just learn about these solutions and see them, you actually experience them firsthand, whether it be immersive therapeutics, medical extended reality that's really reimagining how care is experienced, really new ways for treatment optimization, to let's see, what was that? You had this capsule that you swallowed recently that has a micro camera in it, wireless camera in it, that's really re-envisioning how endoscopies experienced. And then, of course, there's that robotic exoskeleton that's really transforming how people are able to experience rehabilitation, to walk again, and maybe even augment human capabilities moving forward. So without further ado, Daniel, if you could start us off with what's new and next in health and tech.
I'll see if I can shoot a little quick taster for the intro about how we can catalyze the next revolution and where care happens. Of course, down the street from me in San Jose, NVIDIA's having their GTC conference. AI is the rage. I think AI is more of a connecting technology to enable all these elements of care, particularly new forms of remote patient monitoring and where care happens. It is an interesting time in health and medicine here in the United States. Lots of potential, lots of challenges, some winds at our back, but it's also a time where we have new winds on our sail to push healthcare forward in new forms, including the Internet of Medical Things, LLMs, and new ways of thinking about design and consumers at the center. For us as clinicians, for the last few years, AI and LLMs have already been able to beat us at the medical boards. I'm actually giving a talk to the USMLE next week to how they think the future of medical education might be. But for each of us as consumers and patients, we're no longer going to Dr. Google, we're going to Dr. GPT to get some of our health answers. And that's trying to democratize healthcare. And I think the news you're all aware of in the last month or two, ChatGPT Health has launched. I'm still waiting to get off the wait list if anyone's listening, but it's still not perfect. It's still early days. A paper from Nature last month highlighted that effect that might be under triaging and over triaging in some cases. And so these still have a bit of ways to go, but it's exciting now that with Anthropic launching their Cloud for Healthcare, Microsoft last week announcing Copilot Health, that each of us as consumers, as patients, will be to integrate our multimodal data in new forms. There's a launch of these free primary care type platforms, which can again connect your HealthKit, your your Epic data, and your wearables, and give you anytime, anywhere access. So it's a challenging and interesting time for those of us who are traditional physicians. What will be the case when, it might be malpractice not to use the AI making a diagnostic or therapeutic decision? So the future's coming faster than we think. We'll have a discussion today about how to bring it even a bit faster. And thematically, we want to move from our, current model of intermittent reactive sick care to a future of continuous proactive anywhere care, and shift where and how that care gets delivered, which it's a team sport. It's not about the technology. It's often about aligning the incentives and to enable this connected circle of the usual four walls and physical sense to virtual meets physical meets digital, and how we train today's healthcare workers, and we'll align the incentives and workflows to make this happen. So a few things in the remote patient monitoring space we might touch on later. There's now new ways to use consumer wearables to track blood pressure that are getting FDA cleared, to maybe soon blood sugar. So what are we going to do with patients and consumers with 24/7, not just steps, heart rate, blood pressure, and blood sugar? How are we going to integrate that into proactive care? We're seeing the next generation of other ways to sense ingestibles. There's a Fitbit for the stomach, or now the Pillbot, which I get a chance to swallow, that can take an upper GI study from an inpatient setting potentially to outpatient at a fraction of the cost. Big pill, but I was able to swallow it. There are now sweatables that can track not just the sweat of a marathon runner, but those who might have renal disease or heart disease, and leverage that into care. Breathables are coming to manage and potentially pick up disease at the point of care or in a pharmacy or even at home, that will give us early proactive indications. And the next generation of integrated FDA cleared patch or wearables like BioIntelliSense integrate basically an intensive care unit level data into a single platform, and don't just give you the data, but an operating system to make sense of that in context. So actionable intelligence. So a whole range of new technologies, from camera-based ways to manage wound care, to using your smartphone camera as a way to do a home-based urinalysis, are changing the landscape of where care gets delivered, how it's evaluated, and how that can connect into our care paradigms. Even voice can now be a biomarker to predict everything from high blood pressure to high blood sugar. So I think back to the main theme, from now near to next requires the integration of a lot of these new tools and technologies, aligning not just the technology, but with the mindsets, the systems, and almost creating a bit of a new operating system for how we move from care from our traditional settings to everything from your pocket to your home and beyond. So excited to have the conversation today, and Digital.Health plays a role in helping integrate, source, and allow you to find the solutions that are existing and on the cusp of arriving to enable care for all. So with that, I'll hand it back to Parisa, and looking forward to our discussion.
Thank you, Daniel. What a great start to our session today. I'm delighted to now introduce Stefan Konya to join me here on stage. He is the Chief of Innovation and Strategic Partnerships at the Office of the Assistant Secretary for Technology and Policy, ASTP, former ONC. He's also the co-founder and government chair for the Together.Health community. So such a delight to have you here to share your insights of what's happening on the national level today.
Great, thank you, Parisa, and Daniel. Great intro. Thanks for showing us all that's possible and all this exciting emerging technology, as you always do. I always love tuning into your shows when you can kind of talk about the latest and greatest things that are coming around the corner or right around the horizon. What I'm going to try to do over the next 10 minutes is actually try to tie a lot of what Daniel said along with the national policy framework for health IT in the U.S. Over the past 20 years, connect the dots on some of these areas that he talked about. So how the infrastructure that we've been trying to lay over the last 20 plus years is really made it possible for a lot of these things that Daniel was talking about to now be adopted and hopefully scaled and taken advantage of to make impact, drive down cost, improve outcomes, create better experiences for patients, in more efficient workflows for clinicians. So over the last 2 decades, our agency has really been at the forefront of trying to push digital adoption, And it really started, well, first in 2003, 2004 with an executive order. But then it wasn't until 2009 when the HITECH Act was passed that first set the adoption of electronic health records within the US, moving from paper to digital formats. And sorry. And but that still left a lot of challenges with interoperability. And specifically, there was information blocking practices that were taking place. So once we reached the 21st Century Cures Act in 2016 is when we started to try to leverage those EHRs for more value. So again, to try to summarize 20 years over this, the idea is that as we're building this infrastructure, we wanted to make sure it can support many meaningful new capabilities as they came along, and continuous sensing and connected care, scaled precision medicine, agentic AI for administrative workflows, and the early stages of digital twins is something that now we're hoping we can benefit from. But the points are is that we've been building this infrastructure now for quite some time, and with the advent of the 21st Century Cures Act, we started to finally close a lot of those loopholes where it came to information blocking practices and so on, and now have the infrastructure in place to really realize all this emerging technology that we're trying to advance. So what types of foundation does this, ultimately enable? What types of technologies can it? As you have this full-fledged interoperability, we know there are still some areas that we need to improve upon. We now have standardized API-driven access to clinical data. We have several capabilities that have moved from conceptual to practical. And first, Internet of Medical Devices, IOMD, and wearables can stream data directly into clinical systems and smart on-fire applications in near real time, supporting remote patient monitoring programs that are tightly integrated with existing workflows. So we know that precision medicine initiatives, something that we've been working on for a long time, alongside all of this infrastructure we've been trying to build, can finally start to leverage multi-source data coming not only from EHRs that we've invested in, but from genomics, imaging, longitudinal sensing, and to inform a more individualized treatment decision. And third, agentic AI, something that was all the rage in many of the conferences that we just have been all attending over these past few months, can now orchestrate multi-step administrative tasks such as scheduling, referrals, prior authorization, because they can now reliably read from all these systems that we've put in place and write to those underlying systems as well. And all of this culminates in a longer-term vision of digital twins that I'm hoping will really start to break into healthcare in a way that we haven't seen yet, as it's been deployed in so many other sectors and industries much further ahead than we are. But it's one of those areas where I feel like it can really benefit the advent of digital twins to continuously represent patient state and response to interventions. So first on Internet of Medical Devices, wearable, smart, RPM, the idea is that now we have the ability for connected sensing and smart enabled care. Again, that can be from multimodal sectors of different types of technologies that can feed into an EHR and be accessible where the clinicians want it. The advent of Fire and Smart on Fire have allowed this plug and play ability of all this technology. And then when you look at reimbursement pathways from remote patient monitoring that are coming through CMS in just the past year or so, and the signals that they've been on wanting to pay for these technologies, it really does give us the opportunity for seeing scalable models of longitudinal data-driven management of chronic conditions. On the topic of precision medicine, again, we're starting to see this at scale, not just something that lives in unique silos or in research areas only, but something that's starting to actually make it to the bedside in clinical environments. It depends on integrating this data across a lot of domains: the history, clinical history, laboratory values, genomics, imaging, and more real world and sensor data. And historically, those data sets were really fragmented across the entire ecosystem and difficult to access, but we're seeing more and more integration of that data being a possibility these days. So it's the combination of the high-tech driven EHR adoption and as well as cures driven interoperability that's really making all this feasible to give that complete view of an individual patient. And then layer on top of that the advanced analytics and AI models that can stratify risk, they can predict treatment responses, and identify optimal therapy sequences for specific subpopulations rather than just for the average patient. So in practice, these shifts from reactive trial and error paradigms toward more targeted, preventative, and efficient interventions is what we're able to see. And then on this other topic around agentic AI and administrative work, again, this is something that we've been extremely excited to try to figure out how to support. It's not just the AI tools being developed for clinical settings and clinical use cases where FDA and our agency and many other agencies have been collaborating for years to ensure that they're being safely deployed and evaluated, but also we're looking at the more immediate term, seeing value from the administrative domain. Some say maybe the less sexy side of AI, but especially with the use of agentic tools and supporting in the future more plug and play ability of these agents is something that can achieve so many different areas of improved experience for patients as well as for clinicians. Schedule this follow-up visit and complete the referral being a scenario that we can easily put to task for agents and to automatically execute those underlying steps along the way, even across multiple systems, and having agents speak to agents even is something that we're excited to see how we can support. So again, these agents can access calendars, benefit information, order sets, messaging channels through standardized interfaces, and they can coordinate tasks that currently consume a significant portion of clinician and staff time. So improving really across the efficiency across the entire administrative staff. And we know that in certain areas, like whether it's in cancer therapies, in treatments, we know that sometimes those appointment scheduling tasks can be even more exacerbated and difficult. So the opportunity to really improve, an individual patient who's going through that cancer journey with a more streamlined and efficient process is something that is one use case that I think, is very obvious. So, not only is this going to reduce administrative burden and burnout, but also lead to a more reliable, timely experience for patients who are likely to fall through the cracks and handoffs and referrals otherwise. So, again, digital twins, as I mentioned, is one of those areas that I'm extremely excited about. If you're not familiar with digital twins, it's a dynamic computational model of a patient that is continuously updated using data from the EHR, which we obviously have invested in over the last 20 years, but also coming from imaging, labs, and other connected devices, like many of the wearables and other sensors that we were talking about before. And as more and more of these modalities become interoperable and exchangeable, it's going to make it easier and easier to feed next generation development of digital twins in healthcare. So the simulation and AI techniques that can evaluate what if scenarios in a digital twin, or how a patient is likely to respond to a new therapy or a dose adjustment or an intervention in a lifestyle or care setting. For complex chronic conditions, this enables earlier detection of deterioration and more precise selection of interventions before adverse events can occur. So again, I think that digital twins require exactly what our policy framework has been building toward: consistent, longitudinal, high quality data, and the permission to use it responsibly for the patient's benefit. So, all of these things, again, I think that are leading to, addressing the operational pressures of today on health systems, such as workforce shortages or financial constraints, rising acuity, is going to make a force towards shifting towards adopting more of these modern technologies. And we're hopeful that the infrastructure that we've built over these past 20 years is going to be able to support that. And not in the next 5 to 10 years. I know we're talking about the hospital of the future, but I'm bullish on it being in the next 1.5 to 2 years, seeing many, many more of these technologies being used at scale. So with that, I'm looking forward to the conversation with this amazing panel that we have and talking about what else we can do, not only in this current year to try to support the hospital of the future and all the work that they're doing, but also what are we not doing that we can continue to try to work on in partnership between government and the healthcare industry as a whole. So thank you.
Thank you so much, Stefan. This is fantastic. I definitely share your enthusiasm for AI agents because, we're really inundated in the opportunity to be able to leverage these technologies to free up our time. Then we can do all the things we talk about at the intersection of health and tech and start to integrate more of these technologies in the care we provide. And again, like you said, with digital twins, really take the trial and error out of healthcare and have a more precise, tailored to the individual, better care and earlier detection, and then providing the precise care for that patient. So thanks so much for the important work that you're leading at ASTP. All right. So at this time, I'd like to invite Dr. Daniel Kraft and Dr. Jared Conley and Casey Gronak and Manish Ladha to join us. So we're excited to now have our deep dive into our panel discussion on Hospital of the Future, advancing smart connected care with AI and data-driven insights. So Daniel, take it away.
Fantastic. Well, thanks, Stefan, for that great opening. And we have an amazing embarrassment of riches with our panel here today. I'm going to let each of them maybe do a quick intro themselves, maybe share a little bit of their perspective on what the hospital of the future is, which may not be the hospital at all. And then we'll sort of dive into how do we enable that future in a collaborative way. So, in no particular order, I'm going to start with my friend Jared Conley over from MG Brigham, who's been leading a lot of the hospital to home evolution in Boston and beyond. Jared.
Thanks, Dan. Enjoyed the comments so far. I'm really looking forward to diving in with everyone. So yeah, I'm an emergency doc at Mass General and on the faculty at Harvard Medical School. I help run an emerging technology center here at Mass General, where we're trying to figure out all the different technologies that we can embed into clinical workflows to make care better, safer, and ideally more affordable. And one of the particular areas we're focused in is this concept that Daniel helped coin last year at NextMed of a homespital. Or in other words, trying to decouple care and facilities. Those two concepts have always been together since kind of the 20th century. The more advanced we get in our care capabilities, the more we're centralizing it in that societal resource we call a hospital. But the beautiful thing is science and technology is making it such now that we can decouple that relationship. And we're doing a lot of work in that space, thinking about, areas such as remote patient monitoring, point of care diagnostics, whether that be blood or imaging, supply chain management, and essentially, again, giving you the same type of care that you can get at Mass General, but doing it in the comfort and convenience of home. And we're on this journey with, now dozens of hospitals that are pretty advanced and hundreds that are kind of in various stages of exploring it. And so we envision the hospital of the future much more where you just come to see me, an intensivist, and a surgeon, and have a very limited floor capacity. You would obviously still have some sort of floor capacity because these things are more complicated than sometimes we make it seem, but much less of a ward in the hospital itself, where that would actually be delivered in the comfort and convenience of home. And we're pretty excited on the opportunity there and to really leverage these emerging technologies that make this more and more feasible. So I'll pause there.
And just one quick question. You're operationalizing this, but what lessons have you learned in training the house staff, residents where I trained to leverage these tools, the nurse, the visiting pharmacist? What's the kind of key crux of connecting the dots on the workflow?
Yeah, it's challenging from a cultural perspective. This goes in the face of everything we've been trying to do, right? Everyone thinks, oh, I'm acutely ill. I need to be in that hospital. And so it takes a journey, right? Trying to rewire everyone's brain, whether it's the patient, the family, the staff around, hey, you could actually deliver this care at home. So it's a lot of training. It's a lot of showing the data and showing that we have randomized control trials that show that this works. So we've done a lot of feeding staff, data to show this is, effective. And also, again, just data around patient experience, better sleep, all the things. So, in God we trust, all others bring data, as Edward Deming used to say. So a lot of it is just feeding data and building on that culture. And once people have had a few experiences with this hospital concept, they're bought in. And frankly, they just start self-referring.
Perfect. Thanks. Now over to Manish Ladha. He's a Senior Director of Product Management and Product Development at Connected Care at BD, and BD's creating and evolving a lot of these connected technologies that are enabling this whole movement. Manish.
Thanks, Daniel, and good morning and good afternoon to all the panelists as well as the attendees. So great to be here. Just do a very quick intro. Manish Tata, as mentioned by Daniel, I lead product management here at BD, specifically in the connected care segment, which has been established sometime fairly recently, but to effectively look at smart connected care. And I think in the context of this discussion, where BD, as at BD, we see the hospital of the future not as a building or as a place, but more as a connected care ecosystem. And effectively, it's where data is flowing through various devices that are in the hospitals, but from the devices to the clinicians to the care teams across the care continuum, across all the settings. And effectively, the whole vision of a smart connected care is to basically look at converting this fragmented sort of data into something that is more trusted and real time. I mean, basically taking that intelligence to insights, looking more and in the area of both proactive, not only prescriptive but proactive and personalized care. And this kind of extends beyond the patient in the hospital, but also as the patient goes home. So it's taking that entire ecosystem, just trying to build in together. As mentioned, I have a background in product management across other areas as well. Just prior to BD, I was working for one of the largest sleep and respiratory care manufacturers, and again connecting those devices to the cloud, getting that data and using that for providers and for patients alike. But prior to that, when I look back at the connected setting itself, I've been in companies like Microsoft and Honeywell, where it was about cloud connectivity, but across all devices, but really honing in onto the hospital and the healthcare system. This is where I think we see the vision of going beyond just legacy connectivity. Connectivity, in a way, is just table stakes right now. Getting data from devices is basic table stakes, but really creating meaningful insights from these connections, whether they may be dispensing cabinets in the hospital, whether they be infusion pumps, whether they be pharmacy robotics, and effectively unifying that data into an ecosystem is where BD's vision is moving into. And these launches that we had recently represent these milestones in the connected care, the whole ecosystem, where we are moving from a broad portfolio from the pharmacy to the bedside, and leveraging AI as one of the key levers for us to push forward. Ultimately, it's about gaining that efficiency for the hospital, but also impacting patient care. I had a couple of slides. If I can just quickly share that and then continue on with the discussion. Is that okay, or do we
Perfect.
we can do that later as well?
Share away.
So as mentioned, the vision of BD from a connected care segment is not, as mentioned, moving beyond just the connection itself to more from connectivity to connection. So really taking that ecosystem along. If I look at the launch that we recently did, wanted to talk about very briefly BD Incada, which is basically BD's brand, as we have developed this connected care platform, which is effectively, as mentioned, utilizing AI from using that data, and it's cloud-based. So it's a platform that unifies all the data from the various BD devices and technologies into one ecosystem. And I'll quickly share an example and a use case that has been used there. But think about BD Incada, this particular brand, as a way to collect all the data together at one place, but also make it easy for the users, in this case, let's say the hospital admin, the nurses, the clinicians, to go about and think about their jobs to be done in a very seamless fashion, where the data is not siloed. It's in one place, that the data is close to real time in some particular cases, but effectively handling this care continuum together. And as I mentioned, this was a recent launch that BD did for the connected care platform. And effectively, it is trying to bring in data from the various devices, as mentioned, creating this secure platform where the data and is fidelity, but also secure and backed by AI, but moving into certain areas where, right from device management, so to do remote software updates, to have one single way of identifying the users. So the whole authentication, authorization. So each of the devices, you don't have to do a separate way or a siloed way of identifying the actual users and the workflows associated with that. And then analyzing the data together and visualizing it in a form, which again, through AI technologies like natural language search, the ability for clinicians to query almost as if they would do it on Google search or ChatGPT. You're not expecting the people on the user side to know SQL queries. So taking the minutiae out of them and really giving them outcomes that they can actually drive. So this is the overall vision that I just wanted to very quickly share in terms of how BD Incada as a base or a foundation for connected care is trying to highlight these offerings to the clinicians, to the nurses, and then ultimately to the patients. I'll just pause here and then pass the mic back to Daniel.
Fantastic. One quick question. How do you play with others, right? Whether it's a hospital or a home or a hospital, not all the devices come from one platform.
Right.
Do you have the interoperability built in for other?
Absolutely. I think that's a great call out. When I talked about one of the areas of clinical interoperability, that's ensuring that it's not just the EHR systems, the Epics and the Cerners of the world, where we have data flowing in, but also all the messaging, the ADT messages. So from a technical standpoint, the ability to work across existing hospital settings is going to be really key to make sure that the data is not siloed, and moreover, you're not repeating the same integration over and over again.
Right. Perfect. Thanks. Our last panelist, and then we're going to jump into a conversation, is Casey Granick. She's manager of precision at Wake Medical. So, Casey, welcome, and maybe your thoughts on your definition of the hospital future, maybe some insights of what you're doing at Wake Medical.
Thank you so much, and I'm happy to be here. I'm Casey Granick. I'm the business lead for precision medicine at Wake Med, which is, a broad term to say that we're really trying to infuse our individualized genetic information into the day-to-day care of how we look at patients. My background is in health insurance, consulting, national policy and regulation, but most recently with Wake Med, I was leading innovation, and which is how I've been able to build a network with BD and with others, because we really see the importance of working outside the healthcare system with our external partners who are subject matter experts in gathering data in wearable devices in precision medicine and trying to bring that into the healthcare system, so we can focus on what we're good at, which is caring for our patients, and let others help and support us by doing what they're good at. So right now with precision medicine, this came out of my work within innovation, where we're actually looking to whole exome sequence over 100,000 participants in the Wake County, Raleigh, North Carolina area, where we can just deliver the CDC Tier 1 conditions back to them immediately and to providers, which is your breast cancer, ovarian cancer, hypercholesterolemia, and Lynch syndrome. And so it's really trying to turn precision medicine and genetics on its head and looking at it from a more proactive standpoint rather than a retroactive standpoint, which directly impacts the way that we can care for our patients, even from a hospital at home standpoint of, once we sequence patients, we can then query their genetic information for pharmacogenomics. So if we're wanting to, give a certain medication to a patient, but it's a black label medication, then with our work within precision medicine, we can place an order in Epic, and then within 5 minutes, we can know if that medication is going to potentially harm or help our patient. And it just goes so much more broader than that, but it's really trying to take the individualized care that's required for our patients to the next level. So it can enable things like hospital at your home. It can enable wearable devices to be actually supported by physicians rather than questioned by physicians.
Thanks. When you're thinking about the sort of genomic side, pharmacogenomics is sort of the low-hanging fruit. How does that integrate into the workflow? Is it just a black box warning, or is it going to tell you maybe to adjust a dose or pick a different medication altogether?
So that's a great question. I think the important thing that I'll call out is Wake Med is one of the largest healthcare systems in North Carolina. We're the 10th busiest ED in the United States, but we're a non-academic medical center. And so when we're thinking, and we're a safety net hospital, so when we're thinking about how we can approach our patients in a real-time, effective manner, our physicians want reliable information that has been, studied for years, strong clinical pathways, which is incredible. And at the same time, it's also defensive medicine. So it's a little bit harder to integrate some of those clinical pathways post the warning versus like, hey, heads up, like, do you want to run a genetic test for you to interpret what those results could be when it comes to, prescribing or giving a patient something like clopidogrel, or, but something less risky would be like an SSRI, where we can do a pharmacogenomics test and we can say like, hey, we think like this would work better than this one. So it's really just a risk. It's where providers look at risk. And so I think academic medical centers are probably a bit more attuned to looking at a black box label and saying like, yes, please tell me what my dosage should be, versus non-academics are like, wait, I have 1,000 more patients to see. What do I do next? So it's really trying to build out that infrastructure to support our providers to make those really good decisions.
And decisions, as Stefan kind of highlighted, are becoming reliant on much more multimodal data and even the sort of digital twin. Maybe I'll cycle back to Stefan. And how does the regulatory and the policy elements, maybe examples from HHS, now starting to incentivize using, maybe it's bring your own wearables or other sort of forms of information that aren't usually inside the traditional EMR, and then the ways to sort of present that to the clinician, whether it's pharmacogenomics or blood pressure.
Yeah, so our agency at ASTP, which is also known as ONC for the most of the bulk of the 20 years, has been, again, really trying to support this with many of our technical requirements around API access. So in the Cures Act, we really did a lot to make sure that APIs were available for full EHI export. And some of the information blocking provisions also do apply to write APIs and being able to pull in data from wearables and sensors and other modalities. So we've been trying to support that, again, like I said before, really, for years now. And in parallel, like I mentioned before, during the early days of the Precision Medicine Initiative, we had projects like Sync for Science and Sync for Genes, which were trying to lay out, FHIR-enabled data sharing between genomic environments and research environments, and getting that, available into the clinical settings. So this has been something that's, from a technical standpoint, we've been trying to support for years and continues to evolve as technology evolves. But more recently, I think some of our other advancements around US CDI, our US Core Data for Interoperability, which is also out of the Cures Act, but now we're on proposed, version 7 of that evolving standard, as always. I think a lot of the data elements that are in there now, requiring a foundation of what's available in an EHR, and then also what could be organized inside an EHR, helps to support some of the integration of this sensor and wearable data, remote patient monitoring related data, from other passive monitoring devices, whatever it may be. And then if you look outside of our agency, outside of the technical approaches that we've been taking to build those infrastructure lanes, we've had a lot of support from CMS and leadership from them just in the last year and a half under this new administration, where they've been specifically calling out the desire to reimburse and pay for many of these technologies, and specifically even having the CMS administrator come out and say, we want a wearable on everybody's arm, and really kind of, coming out with that visual, simple, contextual statement of, we believe in the value of these tools in the marketplace. And really, once we get more of that data out there being collected, the use cases for adopting it and integrating into any number of different things makes it much more valuable. The other thing about this is where we're at today compared to 10 years ago is a very different environment. So the specificity and quality of the data coming from wearables and remote patient devices and so on is at a level that's significantly higher than it was 10 years ago. And I think you've seen, correct me if I'm wrong, we've got some clinicians on the call here, so they can refute if this is not the case, but the appetite that we used to, or I would say rather, the lack of appetite that we used to see 10 plus years ago for wearables data and patient generated data, where really they didn't know what to do with it. They were concerned about the liabilities. How would we integrate it? Can we rely on it? Again, if we don't take action based on this data and it's available, but we don't trust it, what are we going to do with it? That paradigm has really shifted now to where there's actually a strong pull demand for that data, where they're saying, we'd love to have more of this reliable now, and more easily integrated and accessible data that is a longitudinal view of our patient. So it's not, if you even just take something as simple as blood pressure monitoring, to have a doctor be able to look at a full longitudinal data set and to see that there was a spike, that was, in a limited time frame, maybe over the last visit when they came in to see them. But other than that, it had been pretty normal, it had gone down even. They could say, okay, what else happened in your life at that point? Did you just get fired? Was there some kind of other issue that caused stress? Was there a hurricane coming that day? I know we've actually heard some of these use cases from a company called Higgy back in the day, where they were doing, real-time monitoring of blood pressure at locations like Walgreens and CVS. And they did this amazing study about when this hurricane came through and hit, and the blood pressure readings leading up to the hurricane arriving, and then in the days after, it obviously went dark for a few days as the power was out, and people weren't necessarily going into these stations, but you could see it start to spike right before as people are getting anxious and stressed out about the hurricane coming. And then over time, it started to drop off. And this is at a population level analysis, right? So the idea is, again, with this longitudinal data, you can have a more holistic view of the patient. And nowadays, there definitely is a greater demand for it. In fact, that's part of why we've been getting a lot of pushes to ensure that write APIs are just as supported for interoperability as much as read APIs are, because they want more and more of this data on a daily basis.
So let's put this back into a today clinical context. Over to Jared. I mean, you're attending in the emergency room at MGH. How often does a patient show up with their wearable data, and is that ever useful? And then maybe some examples of folks using bring your own devices in your hospital to home element where you're pulling in non-traditional data feeds, or are you able to do that now? And where might you want that to be in the next 2 to 5 years?
Yeah, thanks for bringing us all together. I think it's a nice way to think about where the hospital of the future could be. I think to Stefan's point, at the end of the day, yeah, I think 10 years ago the data wasn't there wasn't enough evidence that the data was good, but we actually have data now, and I frankly know it anecdotally, where patients will come in and say, "Doc, like I was at the gym, I was working out, and this watch is telling me I'm in AFib. I don't even know what that means, but I'm here." And frankly, again, anyone that's followed that data, it's really, really good, right? And I've had plenty of docs. I speak on this pretty often, and I've had plenty of docs in the last couple of years be like, "I had no idea. I didn't ever believe that data." But now we know that again, certain types of consumer wearables is actually very accurate. There's plenty of examples where it's not yet, but we're getting closer to that. And I think it actually speaks to Manisha's point earlier, where what I think the hospital of the future is, or let's just say acute care in general, is actually more of a connected state, right? So this idea of connected care, I think, is very powerful, where instead of it being based on where you can find services, it's actually more centralized around the patient, right? So you can call this hospital at home or hospital or as, an aspect of the hospital of the future, but what I actually think is the broader topic is actually just connected care that's being delivered more patient-centric ways. So if you can, anywhere you can follow the patient, if it's safe to deliver that care there, it should be the closest possible to the patient. That might be their home, that might be, their office. Generally, I'd say it's more their home. But for instance, of course, if they need surgical care or ICU care, emergency care, right? Clearly that needs to happen there. But the data that's coming to us from, consumer wearables and other places should all be feeding in so that I can say, yes, to Stefan's point, like, gosh, I had this the other day, right? A patient that came in with elevated blood pressure. There was like, is this new? Is this old? Should we be starting on meds? And having data to say like, hey, actually, this isn't new. You've been having these readings for 3 months be on medicines, right? That is true connected hospital of the future type care that I think we'll begin to see more and more. And I think to Cassie's point, right, it's precision medicine, right? So that this all really does come together nicely.
Yeah, it's connected.
But how do you, sorry,
Go ahead.
Dr. Conley, it's just interesting that you mentioned that it's your patient that's saying like, here's the data that I see. Can you help me understand this? Versus what we would like to get to is, oh, actually that data is embedded into our EHR. I actually already know that. Because what we run into as a healthcare system is when we do not have tons of resources to integrate all of this into our EMR, to security issues and data ownership. We run into data ownership issues all the time where it's, even Epic or Lab or whomever saying like, we own the data, we're not giving it to you, kind of thing. And so, we have many scenarios where it's our patients saying like like their glucose monitor that they're wearing on their body. You actually aren't allowed to record those in the EMR because it's a wearable. It's not FDA approved for that type of medical record completion. And so again, non-clinical, sorry, as I try to stumble over some of these words.
No
But
worries.
what I'm trying to say is so many of our providers want this wearable technology integrated into the EMR, but we run into so many roadblocks. And so as we try to continue to push forward with understanding data ownership, understanding how a healthcare system can affordably provide interoperability when it comes to data, are you are there paths in which we can continue to enable our patients to provide that data to their physician, and then the physician trusts that data?
Yeah, you're pointing out, it is very still messy. I was just with David Rue, who I think many of you know, the CMO of Microsoft. There's efforts to try and make people play together in the playground. Whether that's companies, health systems, et cetera, because there is a lot around data ownership. But I think what we want to move towards is, and maybe our ASTP folks can help put some teeth to this, right? Where there's actually some data sharing that's required, because unfortunately, sometimes
Yes.
that's the only thing that gets people to share. But maybe where we get to that point where there is a standard platform that, and obviously, I think to Daniel's point earlier, right? It might actually end up being some integration between that and the OpenAI Healths, the Anthropic Healths, the Microsoft platforms that are multimodal, multi-agent, that can be able to surface some of the data in a way that's digestible to a physician at the point of care. So we're not there yet in terms of that connected data point, but you can certainly see the future. It's a little murky on how we're going to get there.
But I think we can all collectively say that we want to get there.
Yeah, and I think
Yes.
and where that starts is with the empowered, engaged consumer, which can now do self-care and they can opt in to share their wearable data and gives you not just artificial intelligence, but contextual intelligence. And the future of the physical exam is to have this layer, this hospital to hospital is your sort of hospital everywhere, anytime, looking at your multimodal data. And it could come from Anisha BD, it could come from I've got my Whoop and my Apple Watch and two smart rings. They all are going to become a bit commoditized. Already today, they give me a bit of a health radar, know that I'm behind on sleep and I'm jet lagged, or that I'm having signs of maybe early flu and I might want to isolate or take a antiviral. So, um, you
Yeah.
know, it's already becoming pushed by the consumer. Manish, what do you see from that lens? And is BD kind of bridging over to direct to non-clinician?
Right. No, I think just kind of completing the earlier thought, I completely agree that the issue isn't just about the lack of data. The data is there everywhere. It's about this context itself. Like, of course, clinically contextualized, but also when we talk about interoperable across these devices, care settings, which also includes the patient in the loop, the human in the loop. We talk about human in the loop from a clinician perspective, but also the patient in the loop. So there are some strategies underway to kind of start thinking about how we go not just from the device to the hospital or in hospital care, but how does that extend into the at home? So there are some plans underway, or at least some initial insights. I think all of it is coming back to effectively ensuring the right amount of patient care. So even when we think about bringing AI in the picture, and let's say it even becomes autonomous, it's not about it's about getting the right clinical judgment and then moving that care setting back to the patient. So that's definitely the impact on the patient outcomes is key in terms of how we're thinking about this in the future.
One question I often get is about the privacy issues and the liability. And you can see that shifting. I mean, a Waymo will come to my house now, and that's a lot of regulatory and technology coming together. Any insights from any of you, maybe from both the policy and the operational element, about where are the real opportunities to really super accelerate the outcomes, just like Waymos are safer drivers than humans, but get around the privacy and legal issues?
I'll say, unfortunately, to counter that is we actually have physicians who don't want some of that information because it's not presented in such a way that it's actionable. So we can sequence your entire exome, but our physicians do not want access to that entire exome because it becomes a liability. When they're like, well, you already knew that I had that if you were to look at my genetic information. So we've actually chosen a partner in which that information lives outside of the EHR, and purely it's from a liability standpoint of like we can't present it to our physicians in a consumable manner. So I will say that we would love to be able to approach that, but there are so many roadblocks and barriers. Sorry to be a Debbie Downer, just wanted to point that out.
Yeah, and I was going to add a slightly different perspective to this too. We're taking a look at it from another angle. So, Jared was talking a little bit about the fact that, the hospital of the future is really part of a more of a broader ecosystem. And it's, it just as much as like from a tech side of things, the data world was mostly centered around an EHR, and we've been working to make it where, while we want to support integration with that modality or that certain domain of data, we don't want it to have to be the only one or the center of that. In some cases it will be the center, and in other cases, in other settings, it'll just be another node of data source to kind of feed into a broader ecosystem. Well, it's kind of the same thing as far as the healthcare delivery side of things. While the hospital is traditionally known as like one of the center of the known universes for delivering care, we know that now there's so many other options available to a patient that include retail clinics, that include in-home care, extensions, sometimes through in partnership with the health system, sometimes independent through a third party, or sometimes even through their payer as an extension of their membership plan underneath their payer. So there's so many different options for a patient to take advantage of, and getting care in different ways that meet their needs and meet them where they are, different ways to be able to offset some of the affordability challenges and so on, that they want to have this variety. Sometimes it's a direct-to-consumer, direct-to-patient solution they'd rather pay out of pocket for than to go through their insurance and not know what it's going to end up costing them on the back end. And so, in this, when we think about the policy and practice side, it's always a challenge for the government to think through, like, how can we both support innovation while having guardrails to prevent from bad actors, safety issues, privacy concerns, all that type of things. And we have a web of approaches that we do, working with many other agencies, obviously HIPAA and OCR, we've been working very closely with for years. But even just if you think about the responsible use of AI and algorithms and what that means among this entire ecosystem, and the ability for all these different institutions to try to manage that responsibly, there's a lot of questions that come up that are both technologically related and challenging, as well as policy related and challenging. OCR has a 1557 rule, which talks about being able to say, we still have to have a plan for how we mitigate for bias and discrimination, and putting that responsibility on the people who are deploying these tools. So if it's the health system deploying that tool, they need to be thinking about, how can I mitigate for bias and discrimination with this tool? It's not up to the tech provider, it's up to the health system who's actually procured it and deployed it. So even if it is a third-party solution coming from another area, if they're the ones using that tool, then they need to think about that. But what happens when a patient chooses to use a tool on their own? ChatGPT their health, or whatever else third-party app it may be. Law says that the health system has to give the data to that third-party tool if the patient is consenting to it, and that's the modality that they want that data from. But then it gets into this gray area where there's not as many protections in place, right? And so, is that patient really being informed about the risks of putting that data into this other environment? And how there may not be as many oversights or controls in those places, including maybe not really fully informing them about secondary use of that data or other things like that. So it's always a challenge as we're chasing the ball with pushing innovation and trying to realize all the benefit from that, but having those guardrails and hopefully not overly regulating in a way where it stifles innovation, but still helps protect, support, trust, responsible use, and accountability. It's always a challenge.
Yep, lots of challenges, but a lot of opportunities. So maybe just our last minute, I'm going to go around the horn and ask each of you in 30 seconds or less to paint your picture of where we might be in 5 years, in 2031, which is still a longer cycle than we've had since ChatGPT launched. Maybe what your aspirational element would be, if you want to sneak in what you think is needed to get there. I'll start with Manish.
Yeah. I think this is the future. I mean, we talk about technology kind of bringing and making that change, but that future of moving from gen or generative to agentic to physical, that's the future that's coming up. But clearly, I think the bottom line there is the whole aspect of trust. Effectively, it's not just about the technology. It's about the technology in the loop with the scale, with the safety. So where I see that, at least where we see this coming, is we have the whole orchestration, the decision support that's happening, a closed loop with all the devices. But the future effectively is the whole aspect of responsible autonomy. Again, with the clinical oversight, but clearly responsible autonomy. And I think that what I just highlighted earlier in terms of the smart connected care is where that data turns into action, action turns into trust, and that trust is basically where the innovation gets manifested.
And there's a quote, healthcare innovation moves at the speed of trust. So that's critical. Jared.
Yeah, two quick thoughts. I'll try and keep it to 30 seconds. One is that hospital length of stay is more halved. And two, that there is a hospital in any home. So Bill Gates had this concept of a computer in any home in the 70s. I want to see in 25 years the ability to deliver hospital level care in any home in America. And frankly, for those that don't have a home, we create a temporary home, whether that's an Airbnb or at a hotel, so that we can deliver incredible care that's high quality care, exceptional acute care, but in the comfort and convenience of a home. And I think, again, whether that's on day one when you meet me in the emergency department, not everyone's safe enough to go home at that point. So you might need a procedure, you might need some more monitoring, but I think our length of stay could be halved, and we could have more and more care in any home in America.
Yeah, I love it. Not just a hospital in any home, but health in any home, and integrating all those dots for proactive prevention, wellness, and thriving, right? So, Casey.
Yeah, so I think, hopefully in 5 years we can have additional tools to support our clinicians to really support their patients, whether it be a hospital at home, outpatient setting, or inpatient setting. But what it comes down to is less siloed healthcare, payers that will actually pay for the tools that are needed by providers, and then giving our providers the tools that they need, that they trust, and then also embedding that trust within our patients as well. And so it's, a tall ask for the next 5 years, but if we can just become less siloed and give our providers more tools in their toolbox to care for their patients outside of the emergency room, outside of inpatient care, then I think that's a win.
100%. Last word over to Stefan.
Yeah, so this is a vision and hopes and dreams, not what do we actually think is going to happen, right? So this is more wish list.
100%.
Okay, cool. So I am very optimistic and bullish that in 5 years we're going to realize and actually see a lot of things that I would wish for, right? And so that it's going to be seeing digital twins actually start to make an impact in certain areas of healthcare. I think it'll still be, the haves and the have-nots, where there's going to be some early adopters at that point. But as of right now, we're not seeing it, really show the results yet. And again, I know we have other industries that are significantly ahead of us. It would be a perfect world, or the right steps in the right direction, if so many of the organizations who are in these community settings and also in subspecialty areas of healthcare, that were left out of the early investments of the high tech era. So behavioral and mental health settings, dental settings, other things like that. So more holistic view of care around that patient is able to be realized and integrated more seamlessly. And you're seeing more of that collaboration between traditional healthcare settings in hospitals and others, extending into the community and partnering with these other organizations that have been in the community for years, meeting their needs in a lot of ways. And yes, that as much of that as possible is actually happening in the home, or in the settings that patients want to get it in from the comfort of their home, whatever it may be. So I do think there's going to be some organizations that are going to disappear between now and the next 5 years, especially in some hospital and healthcare settings. And it's going to be either because they chose not to, or because they weren't able to adopt more of these creative approaches to leveraging, sensor data and these partnerships in the community-based settings and so on through technology. So it's something that we're working to try to mitigate as much as possible and support as many of those organizations through that transition. But the reality is some are just not going to be able to survive the next 5 years. And then that means we're going to have to make even a harder push to meet those patients where they are.
Yeah. Creative destruction. It'll be interesting to see what are the blockbusters of health, or RIMS and Blackberries, when we look back 10 years. So with that, thank you all to our panelists. I'm going to hand it back to our lead, Parisa, to bring us home.
Yeah, absolutely. Thank you so much, each and every one of you, for such an insightful discussion. It's clear that Hospital of the Future will not be a single destination, right? It's going to be this intelligent, connected ecosystem, patients at the center, admitting their digital exhaust, a seamless system, more proactive, less trial and error, more precision medicine, leveraging the digital health technologies. These AI agents are going to really help free up our time. So really an exciting future, and you are the ones helping to drive that change. So thank you so much. We do have several questions in the chat. I don't know if, do you think those were addressed through the discussion, or I know we're over time, but for the sake of the recording, we could still try to address some of those questions before we close out.
Maybe I'll just ask one. I'm just seeing the questions here from Kathy Ireland. Where does preventive health and wellness approaches and recommendations come into the picture, right? Because we often think about the hospital, the sick care side, but there's a huge potential again on the prevention, wellness, even the longevity and health span side. Anyone have any quick comments there?
I mean, I'll just quickly say, again, everything we've been talking about supports earlier detection, next generation diagnostics, longitudinal data tracking, being able to identify more preventative health approaches and interventions at an earlier step. So I think that, just from a technology standpoint is going to be huge. And then again, this idea of being able to integrate with some of these other community-based setting providers is going to take a more, preventative health and wellness approach in general. So.
Okay, thank you so much. Well, I want to thank our Digital.Health Growth Catalyst members and ecosystem partners who are on this journey with us. And I want to thank each of you in our Digital.Health community for joining us for each of our Digital.Health Studio Series webinars. We hope you found this an insightful discussion. And again, the aim here is to really elevate these stories about models that are being effectively integrated in care to inspire others, serve as a model for others to emulate, to really catalyze that preferred future that we're all working to achieve. So thank you so much for joining us as we learn, share, care together.
Thank you.
Thanks, everybody.
Thank you.
Let's go create the future.
Yeah.